Hello, we're here with Dr. Nikko today, and he's agreed to answer a few questions concerning breast augmentation. Hi, Dr. Nikko.
Hi, how are you?
Doing great. How are you?
Good.
How's the family dog?
Good.
Good. All right, so you're going to answer a few questions for us about breast augmentation today?
Yes.
All right, great. Our first question comes from Angela. She asks, I've decided to get a breast augmentation. Can you tell me where the implant will be located? And what type of implant do you recommend?
Okay. Angela, when you say where the implant will be located, I assume that you're asking about the placement of the implant. There are actually 4 different choices, but I'll basically narrow it down to 2 for your understanding. There is the submuscular, in which the implant is placed underneath the muscle on top, which is the pectoralis major muscle. There's the total submuscular, where the implant is placed underneath the muscle on top, but it's also covered by the serratus anterior and some other muscle. So actually, more than 85% of the implant is completely covered by muscle. Now, you do have the subglandular, which is a situation where the implant is located above the muscle. And then there's also the subfascial technique, which really not many people use. But so the main one you want to focus on is the submuscular, total submuscular, and the subglandular. Now, the second part of your question, which implant is best for you? That I can tell you right now that since silicone gel, the cohesive gel came back on the market about 8 years or so ago, we are now doing probably more than 95% silicone gel, which is the cohesive gel. The new technology is really awesome. A lot of people are afraid, back in the old days where the silicone when it breaks and it's leaking to other parts of the breast. With this new type of cohesive technology, the gel sticks together, so you really don't have to worry about it kind of potentially leaking into other parts of your breast tissue. Now, there's the saline, which we don't use that often anymore, but occasionally there are patients who don't feel particularly completely comfortable with the silicone gel. And I tell them, if you're not comfortable with anything, if something keeps you awake at night, don't do it. You have enough to worry about. And saline implants work well too. You just have to realize that they don't feel as natural. And if you're very thin, you may have a little bit of rippling. And so that's the only thing concerning with the saline implants. So which one's best for you? If you're comfortable with the silicone, there's no doubt the silicone gel will give you a better feel and a better look.
Okay, this next question comes from Denise, who says she knows some doctors use the armpit and some the nipple. What do you do?
Okay, the armpit technique is called the transaxillary technique. And that technique I happen to do 100% of the time. That's all I do with transaxillary, because some people don't want any scars on the breast. Some people just prefer going through underneath the arm. And actually, if you go underneath the arm, the transaxillary technique, the scar is hidden in that crease. So even after, after 3 months after, when you raise your arms, you play sports or whatever, you don't have to worry about anyone seeing that incision because it's very, very hard to see. It looks like a crease. The other one that you mentioned around the nipple is really around the areola. Okay, so the areola is the pigmented part that surrounds the nipple, and you can kind of hide the scar in that area very nicely in some patients. Some patients, depending on pigmentation, size of areola, that may be good. For some patients with small areola or areola that are too dark, that may not be good because you can see the white scar running through it. So you have to look at each individual patient very carefully. And then the most common technique, and the one that I use nowadays more often than the others, is using the incision underneath right above crease of the breast fold, and that's called the inframammary incision. Now, that incision is one I use most often now. It's because when I was doing the transaxillary incision, I was getting probably more capsular contracture, which is the overabundance, overbuilding of scar tissue around the implant that I would like. Now, going underneath the crease has really allowed me to decrease that chance of capsular contracture. And then now we have this great device where we can make the incision very short, and we can still get the silicone implant in. And a lot of people really don't see that incision very well. And so I prefer that one. And then plus, if you need any secondary surgeries in the future, going bigger, fixing anything, you can go through that incision. So I just talk to each patient, depending on what they need, depending on what they want. Some people don't want any scars. I still do the transaxillary for many people. But most of the time, I do the inframammary technique because it's easier recovery, and I'm right there. And it allows me to, put the implants underneath the muscles, do the total submuscular. And so there's choices, and it's a matter of sitting down and just seeing what you feel is best for you. And that's how we kind of make the decision for you.
Okay, this next question comes from Anne, who says, I have one child, and my husband and I are planning on having more within a few years. If I get a breast augmentation now, will I be able to breastfeed? And is there anything else I should consider based on my situation?
Now, I have many people who come in and plan to have, a child a few years down the line, and there should not be any problem with breastfeeding. Now, with that said, unfortunately, not every woman can breastfeed in the first place. I believe the statistic is 4 out of 5 women can breastfeed. So if you're the lucky 4 out of 5, you should not have a problem breastfeeding. Have had some patients, experience, when they breastfeed, they may get a little mastitis or a little infection, and sometimes that infection can affect the implants, and then they have to take out the implants. But they can still breastfeed after that. So the question is, if you're concerned about breastfeeding and having a child in the future, and there's no reason why you would have to wait till after having all your kids before having breast augmentation.
Okay, great. This next question is from Sandy. Do you have a set fee for breast augmentation? And if so, what is it?
Okay. Is it Ann to answer that question?
Sandy.
I'm sorry? Sandy. Sandy. Okay, of course. Now, there is a set fee for breast augmentation. Everyone, it varies from if you're getting saline or silicone. Typically, silicone is more expensive because the implants are more expensive. But you're looking at probably starting around, depending on the situation, sometimes it can be a little bit more complicated, but on average, you're looking at $5,000 for saline and $6,000 for silicone.
Okay, Mary asks, I would like to get an augmentation before I'm moving from Houston in 3 months to live overseas. Do I have time to get it done now?
Yes, sure. We take care of a lot of patients who end up, they get surgery and then they end up having to move, and that's no problem. As long as, I like to make sure that everything is going well after surgery, everything went well. So if they can, stay around for a month would be ideal, but I have many patients who a week after, and I know they're going to do pretty well. And especially nowadays, we communicate with so many of our patients who are far away from us, who travel down to our clinic to have surgery from out of the city, out of the state. And we email so much, and then we have live chat, and we take pictures, and again, send pictures back and forth. So follow-up is very easy, and we can manage patients from far away.
So you're saying you require about a month as far as the move, and then how long after that for full recovery?
Yeah, I only require a month because, you know, when you're moving, you're packing, you're doing a lot of stuff. So I just like patients not to have to do a lot of things for a month after their surgery. I ask patients not to lift anything heavier than 10 or 15 pounds. So that's, you know, that's that if you're moving within a week, and of course that makes it difficult. But yeah, typically a month they can travel abroad and it should be relatively safe.
Okay, we have one final question from Deborah, and that's, how will I know if an implant has ruptured?
Okay, Deborah, rupture is obviously one thing that every patient's worried about. Now with saline, you would know within from a few days to a couple of weeks, because the saline really just absorbs right into your body and everything is fine. There's always a little saline left in that pocket, but you'll notice the asymmetry. I mean, you come in right away because you're like, I can tell that something is different. With silicone, it's a little bit different. Now, with silicone, the advantage of silicone is that if there's a tear in that you know, in that outer covering, then of the implant, then again, the cohesive gel that we talked about, it doesn't leak out. It actually sticks together very nicely. And so you can be massaging your breast, squeezing your breast, and then it may come out and come right back in because it just sticks together. And also on top of that, you have a capsule that your body has made because of the implant. And everyone who has implant has a capsule that your body makes to kind of surround this artificial device. And so that capsule keeps the silicone in. So typically you have what's called silent ruptures. And a lot of people really don't know that they had a rupture. And a lot of people, the best way to detect it is really with an MRI. But a lot of people, I can tell you, if they have a silent rupture, they probably won't know it. And yeah, and that's, if they have pain or redness, then there could be more problem, but I haven't seen that at all. And if I see it, I'll send the patients for MRI.
Okay, great, good to know. Thank you, Dr. Nikko. We do actually have one more question, and that comes from Autumn. After a consultation, how long would it take for me to schedule the actual procedure?
Okay, after the consultation, everyone's a little different now. Breast augmentation patients tend to want it now. They're in a hurry. Some people plan months ahead. But some people, most of the time, when they come in and they want something, they want now. But typically, you want to, you know, plan ahead and give yourself, you know, at least, you know, 4 to 6 weeks of time to schedule your surgery. So that way we can get everything lined up and get you on the schedule. So you're looking at planning ahead of time, you know, at least 4 to 6 weeks, sometime 2 months.
Thank you so much, Dr. Nikko. That's a lot of valuable information on breast augmentation.
Thank you. And if you want, again, if you want any more information, please come in and call, and I would love to see, because everyone is a little different. People's breasts are different, shapes are different, there's asymmetry, and there are things that we can discuss and tailor-made to your specific needs. A lot of people like the different shapes of breast. And we really spend a lot of time listening to patients. That way we can pick the right, not just the right size, but the right shape. So if you're interested, just give us a call at 713-960-1311.
And if you have any further questions, scroll down to the comment box of this video and Dr. Nikko will answer those for you.